www.healthcmi.com, Acupuncture Continuing Education Online. Let's take a look at the news desk today. Acupuncture improves IVF pregnancy rates finding. Acupuncture improves in vitro fertilization outcomes. Warm needle acupuncture reduces endometrial cavity fluid (ECF) accumulation and improves clinical pregnancy rates following IVF. So these results were conducted at Foshan Women's and Children's Hospital in Guangdong. So increased ECF, increased endometrial cavity fluid, is associated with poor implantation rates following in vitro fertilization embryo transfer. So what happened was acupuncture was able to control this fluid and get some pretty good results in terms of higher pregnancy rates. So an interesting study, they used acupuncture points CV12, CV6, so some points on the abdomen, CV4 and 3, also some local points, stomach 29, Zigong, and distal points, Zhu San Li and San Yin Jiao, stomach 36, spleen 6. So not an unusual formula, something we might see in a clinic. Again, different than a clinical situation where the acupuncture treatment is customized. This one is a set number of points and exact points specified for all patients in all situations. So it's not a true reflection of a clinical situation in that it's so protocolized and so standardized. There's no flexibility for individual patient needs. However, that does limit variables, and that's the way research is often done to try to give some level of predictive success. So there are different approaches to research where one, you have the highly protocolized study like this, one set of points, everybody. Another set is semi-protocolized where they have one set of points for everybody and a little customization here or there based on syndrome presentation. So 2-3 acupuncture points here or there that you can add or subtract based on presentation. And then finally, there is the full clinical representation. So that would be where patient comes in, they get the exact acupuncture points according to their exact diagnosis, and it's different for each patient. So in some ways, this not only tests the efficacy of acupuncture for benefiting fertility, but it also tests this acupuncture point prescription at the same time. So they did a good job. I don't see any unusual needle techniques or anything like that, just simple Moxa warm needles, which is very comfortable. It's very nice. And nothing really stands out here. They did some hormonal tests. They did some pregnancy rate tests. They basically did a standard type of research. I'd like to see a multi-arm study with stricter controls on some levels than this one. But what's nice about this is it's not the first article of this type. For any of the strengths or weaknesses in this particular piece of research, it is only representative of literally thousands of pieces of research showing that acupuncture can be used for the treatment of infertility in several types of situations. So that's where this research has its importance, because it fits in line and is consistent with other pieces of research and those findings. So we're seeing a general pattern. And this is simply because acupuncture helps to optimize the flow of qi and blood in the body. So that can be, for example, preventing fluid buildup. So qi and blood sounds a little bit mysterious, but these are the ancient terms used 2,000 years ago. But when we talk about qi being the regulation of the sympathetic and parasympathetic divisions of the autonomic nervous system, and we can see those results in not only nerve tests, but MRIs of the brain, then we have a deeper understanding of qi. So qi, again, is a general term. People don't need to be put off by that, because think of it more like energy. Think of it, the energy you get from air and from water and from eating food like rice. Think of qi as the breath of life, but it's very specific. So the qi affecting a specific internal organ does translate into very specific biomedical differentiation. So while we use more poetic and ancient terminology, it gets very specific. And those understandings are now confirmed using mapping of the brain with MRIs, testing hormone levels in the body, including this study, showing exact results for specific, what we call channel qi. So if you use the conception vessel or the Chung channel or all these different things, they actually have specific effects on specific internal organs, on specific hormone levels, things like that. So it's important not to worry too much about the terminology, because if we talk about, let's say something like liver qi stagnation. Okay, so that sounds kind of weird. Something's wrong with my liver. But no, maybe liver qi stagnation is really just saying anxiety and stress. Now that we understand, for example. Or there are other forms of qi stagnation that may refer to blockage of nerve conduction signal, and it's very specific. So acupuncturists know this distinction, and while we communicate in broader terms, it in no way invalidates the ancient terminology, but it is a beautiful and poetic way to look at medicine in a holistic way. So I want to thank everyone for listening. Go to healthcmi.com, look for the article entitled Acupuncture Proves IVF Pregnancy Rates Finding. Thank you for listening. I'm Adam White, licensed acupuncturist. www.healthcmi.com.